Welcome back to the Blue Suit, where we provide useful information for your career journey. My name is Denise McNeil, and I'm happy to be sharing some of my career experiences with you. Today, I am presenting Verifying Patient Insurance Benefits from my medical office video series. Verifying patient insurance benefits is a part of the intake process in hospitals, mental health facilities, crisis centers, nursing homes, and more. Intake specialists, also known as intake coordinators or medical office assistants, as well as medical billing and coding specialists, all have the responsibility of verifying patient coverage so that they can submit claims properly for medical treatment. Before care is provided, it's imperative to confirm how a patient will pay for your services. In cases where patients are covered by an insurance plan, it's equally important to verify their insurance eligibility before care is provided. Failing to do so could leave you with an unpaid claim by the insurance company or a patient unable to pay their bill in a timely manner. Depending on the size of your healthcare facility or whose management you're under, there may be a team of people who handle payment and insurance issues and are adept at managing and processing claims with the insurance companies. If this is not the case, then there are some important procedures to follow that will help you facilitate this fundamental part of running a healthcare office. Let's discuss some of the skills that you should master to verify insurance proficiently. With advancements in technology, using electronic health records and computerized databases are standard practices in the healthcare industry. Health information and record keeping are constantly evolving. This is a non exhaustive list of essential skills necessary for performing medical billing and coding tasks. They are communication skills, patience, technical, and social skills. Of the 4 skills listed here on the skills detail list, I would like to highlight communication skills and patience. When dealing with patients, coworkers, and insurance carriers, having proficient listening and speaking skills is helpful in a busy office, but having patience when dealing with carriers over the phone or when verifying insurance electronically, it is imperative because it often takes much longer than expected and it can cause very much frustration. New patient insurance verification process. This diagram illustrates a real-life sample of the process of verifying patient insurance. In a featured video that I will post later, I will dig deeper and talk more about what you can expect when you actually call an insurance company. The next diagram will illustrate almost the same exact process, except that though the patient will not be new, you will set a particular date and time when you check on all of your patient's insurance benefits, and of course, you will not send a welcome packet. So here you see the first step is the patient calls to schedule an appointment for a service, and then you verify that the client is in the network. You collect all of the information from them, you enter it into a bucket, i.e., the paper intake form or an electronic database, and then you either call the insurance company or you log into the carrier's website, and you will either confirm the benefits or learn that they are not insured under that particular service. If they are confirmed, that's usually when you call back or you send an email and you schedule the appointment and then you send them a welcome packet or some sort of electronic email with your contact information, your address, and parking information, and so forth. Verifying patient insurance benefits is usually a simple task. However, it is important to verify insurance without interruptions because there are a plethora of insurance types and policies. There are a plethora of benefits. You always want to be sure that you capture as much information as possible to ensure that after the patient has received services that your practice can legitimately submit and get paid on the claim. Returning patient insurance verification process, as I said, is similar to the new verification process. Once you've confirmed all of and recollected all of the information and corrected it, you can then reprocess a claim that maybe was denied because it was incorrect, or you can just make a note to the file that the patient's benefits have been verified. This concludes verifying patient insurance benefits, and I hope that you enjoyed the video. If you have questions or comments, please list them below in the comments section, and I will respond as soon as I can. If you haven't done so already, be sure to subscribe and hit that like button. Thanks for stopping by.